So we're looking at the foot of a patient with rheumatoid arthritis and quite severe rheumatoid arthritis. You can see off to the side there how deformed the toes are. So when we retract it and deform the toes like that, it puts a lot of pressure on the metatarsal head. So that's what you get, this callus thickening through here. And you can see that there's a little bit of breakdown right in the center of that callusing. So it's breaking down. There might be a little ulceration under here. So of course, because it's on the bottom of the foot, any breakdown is a potential infection risk. So we've got to go and clean that all up. So we've treated this one quite a bit in the past. This is a long-term patient for us. And we just know that if we take too much off, it becomes really quite tender for him. But then we want to get down to the center, right in the center there, where that black dot is, and clean that out so it doesn't break down. So that'll be the site where there's an actual hard central section, or what we call a corn, in the center there. So we'll just use the tip and just very, very carefully get in through there, and trying not to obviously cause blood on this one. This is probably the fourth or fifth time we've treated this, and it's slowly reducing in size. So this would be maybe a quarter of the size when we first started out 5 treatments ago. So we usually space these out about 4 weeks apart for this patient, just to try and get this ulcer to heal. And it's looking really great. The edges aren't undermined at all. We're just going to try and level those out. Take as much of that non-viable tissue out as we can, and then smooth it all up and apply some moisturiser and a dressing on this one. And we'll probably review this in 3 to 4 weeks.